From the early days after I came to Iraq, I witnessed firsthand the Iraqi culture and the ways of life of the Iraqi people. I was extremely impressed by how generous Iraqis are and how full of life and well-cultured. But I also witnessed the drive and the perseverance of the Iraqi people.
The past few years here at Iraq Country Office were very critical. We've been faced with the most challenging situation ever with the pandemic, and then later on, we were faced with multiple outbreaks. We had to look for a new way in dealing with the new demands. And namely, we had to look for ways to reach out directly to the public, to the people who are in need. And this is where we are at this point in time.
Crimean Congo hemorrhagic fever, it is endemic in Iraq since 1979. After that, every year, Iraq is reported a few cases of CCHF. The biggest outbreak in Iraq was during 1996, when about 48 confirmed cases reported all over the country, with mortalities up to 30% of the cases. As an impact of COVID-19 pandemic and due to the climate changes during 2020-2021, there is a breakdown of the control and preventive measures. So during late of 2021, Iraq reported 19 confirmed cases, and during the early months of 2022, there is an acceleration and increasing of number of cases, which is the biggest outbreaks even in the region. More than 300 confirmed cases.
In the Southern Governor, they say, فزعنا وشوف ما بينا, which means once empowered and mobilized, you can see wonders from the women and men of this country. This is exactly what we did for responding to the CCHF. We empowered people early on in the response. We also mobilized communities. We met with community leaders, with household, with butchers, with livestock breeders, and communities at large.
حقيقة WHO منظمة الصحة العالمية ساندت ودعمت جهود وزارة الصحة في مقاومة والسيطرة على هالمرض من خلال دعم الزيارات الإشرافية ودعم عقد الاجتماعات والتنسيق بين الدوائر المختلفة، إضافة إلى مساعدتها في توفير المستلزمات وغيرها التي تستخدم في السيطرة على هذا المرض.
As soon as we knew about the outbreak, we worked with the Ministry of Health, with also the communities. We teamed up, and our teams have gone to the most remote villages. They visited all the affected areas in the Southern Governorates, and they were able to messages to the communities at large, but also on some high-risk groups like the butchers, like some of the households, leads, and also the people who work with livestock in general. They were able to roam every little village in the south and deliver those messages.
الهدف الرئيسي هو التوعية الصحية في 11 محافظة من المحافظات العراقية و11 محافظة جنوبية اللي هي أكثر تضرراً بحالات الحمى النسفية واللي هي أيضاً هذول 11 محافظة حتصير بها موضوع الزيارة الأربعينية.
Lately, with the Iraqi Red Crescent, the Ministry of Health and WHO joined forces to inform communities and pilgrims that are coming to Karbala for the visit of the Arba'in and ensure that they're equipped with life skills and prevention methods so they keep themselves and their loved ones safe. We wanted to have a safe Arba'in visit, and this is exactly what we did through our cooperation with the IRC. The teams of the Iraqi Red Crescent actually were mobilized and performed thousands of meetings with the high-risk groups. They were able to touch hundreds of thousands of people with messages that will prevent the transmission of disease.
دربنا ما يقارب تقريبا أكثر من 250 متطوع بخصوص مجموعة من الفاشيات اللي تصير حاليا بالعراق، من ضمنها الحمى النسفية، كوليرا، وأيضا عندنا حالات كوفيد. بالمقابل احنا نعرف أن عندنا الزيارة الأربعينية، احنا مقبلين عن الزيارة الأربعينية خلال الأيام القادمة، فنحاول قدر الإمكان أن نستهدف مو بس المنازل والمدن وإنما أيضا نستهدف المواكب وزوار الأربعين. الزوار طبعا احنا نعرف أنه حيكونون سواء عراقيين أو من بلدان أخرى، فسوينا هاي البروشورات باللغة العربية واللغة الفارسية حتى نقدر نستهدف أكثر عدد ممكن من الزوار من غرض التوعية الصحية. أعرف أنه الجو حار، أعرف أنه الظروف يمكن مو أحسن ظروف، بس أعرف أنه إحنا قدها، وأني متأكدة أنه حنكون عندنا فد إنجاز لطيف حنحققه إحنا كمنظمة صحة عالمية ويا الهلال الأحمر العراقي. ما أريد أفوت بالتفاصيل أكثر لأن إحنا هاي كلها كانت عندنا ورش تدريبية ودربناكم عليها، وأعرف أنه أنتم قدها. فزعنا وشوف إيش ما بينا.
We have seen wonders in terms of the control of the epidemic, but we also, the morbidity, meaning the number of cases, have plateaued, and we saw also a decrease in mortality. RCCE is not a new way of working. Its role has been highlighted by the COVID pandemic. WHO Iraq have taken RCCE as a flagship program since the start of the pandemic. We went as far as reaching out to the communities, meeting communities and transmitting the messages to those communities and empowering them to be actors in their health and not just receiving programs.
The RCCE that evolved over the past 2 years has been a big achievement for us here at the country office. We managed for once to reach out to people that we never reached out to in the past. And this has been tremendous, not in essence of the delivery of the program component alone, but we managed to see how people are perceiving our own interventions.
Moving forward, we will extend the scope of the risk communication community engagement to other non-communicable diseases and communicable diseases, and will definitely make RCCE as one of the key interventions that we will use in our quests to promote health, keep the world safe, and serve the vulnerable.